Hola, muy buenos días.
Hello, good morning, good afternoon, and thank you for joining us on today's press briefing by the Pan American Health Organization on the COVID pandemic in the Americas. Today is Wednesday, 28th July 2029, and I am Sebastián Nolel from the Communications Department of PAHO. We have already received your questions by email, and you will be able to ask questions live through the Q&A button. Please always include your name and medium when you send your questions. Also, we have simultaneous interpretation to English, French, Portuguese, and Spanish, and you can choose your option on the button below. Dr. Carissa Etienne, Director of the Pan American Health Organization, will talk about the status of epidemiology and vaccination disruptions. Dr. Etienne is accompanied today by Dr. Jarbas Barbosa, Assistant Director, Dr. Ciro Garte, Director of the Department of Health Emergencies, and Dr. Sylvain Aldeguerri, Incident Manager for COVID-19, all from PAHO. Now, I would invite Dr. Etienne to share her remarks.
Good morning, and thank you for joining today's press briefing. Over the last week, there were over 1.26 million COVID-19 cases and nearly 29,000 deaths reported in the Americas. COVID continues to have a devastating toll in our region, with Argentina, Colombia, Cuba, Ecuador, and Paraguay among the countries reporting the world's highest weekly death rates. Cases have more than doubled in the United States over the last week, mainly among unvaccinated people. The Mexican states of Baja California Sur, Quintana Roo, and Yucatan are also reporting a rise in new infections. In Central America, cases are accelerating in Guatemala, and they remain high in Panama. Meanwhile, in the Caribbean, Cuba is experiencing higher COVID infection and death rates than at any point in the pandemic, and all age groups are affected. In the last week, more than 7,000 minors and nearly 400 pregnant women have tested positive for COVID-19. Cases are decreasing among several South American countries, although hotspots have been reported in Argentinian provinces bordering Bolivia and Chile, and among Colombia's Amazon region. As COVID continues to circulate, too many places have relaxed the public health and social measures that have proven so effective against this virus. And as people move more easily and mingle without precautions, COVID follows. At the same time, our region has yet to access the vaccines that it needs to keep our population safe. So far, just 16.6% of the population of Latin America and the Caribbean has been fully vaccinated against COVID-19. And while vaccination coverage is higher in countries like the United States, Chile, and Uruguay, it remains below 20% for more than half of the countries and territories in our region. As countries have dedicated resources, staff, and attention to their COVID-19 responses, many have been hard-pressed to keep up other essential health services that people need. In a recent survey of health services in the region, 97% of participating countries and territories reported disruptions. 45% reported disruptions in at least half of their health services. These disruptions are having an inordinate impact on our first level of care. The first level of care is the foundation of our health systems. It is here where children go to for immunizations, where expectant mothers receive prenatal checkups, and where people living with chronic conditions receive their medications. It is also here where the most COVID-19 testing and contact tracing takes place. Disruptions at the first level of care have worsened over the course of this pandemic, and the consequences have been devastating, particularly for routine immunizations. More than 300,000 children, mostly in Brazil and Mexico, missed out on their routine immunizations last year, leaving them vulnerable to deadly yet preventable infections. We are seeing as well dangerous drops in measles vaccinations throughout our region. Coverage of the first dose of measles vaccines dropped by 10% in 8 countries in the Americas, including Venezuela, Panama, and Brazil, and dropped by as much as 20% in Suriname. If we do not reverse these trends, we risk an avalanche of worsening health issues in the Americas. Soon, COVID-19 will not be the only health crisis demanding countries' attention. We therefore urge countries to ensure their COVID-19 responses do not leave other essential services, health services, like routine immunizations behind. These services are not optional, so countries must maintain them as they control COVID-19 outbreaks. PAHO has worked with governments across our region to help them adjust and rethink how essential care is delivered at the first level, and we are continuing to work daily with them. Many health systems, including in Chile and Peru, have embraced telemedicine, and others have launched community outreach programs, so patients can continue to be seen by providers from the comfort of their homes. As the demands on our health systems grow, countries must hire and train additional staff and ensure that every health worker has the tools and resources to safely offer care during a pandemic. Equally important is ensuring that healthcare workers are fairly compensated for their extraordinary efforts. Chile, for example, recently approved a pay bump to providers who have been so critical to the COVID-19 response. We know that the economic blowback of this pandemic is forcing countries to make difficult choices on where to prioritize spending. But we cannot afford to cut corners on health, because make no mistake, sooner or later, countries will assume the costs. And that is why investing in the first level of care now is a smart choice, so we can reverse trends that are more efficiently and equitably than if we wait for health crises to surface. As the adage goes, an ounce of prevention is worth a pound of cure. This is also true for health. Prevention is much more affordable than treatment. So as countries debut new COVID funding or seek loans from financial institutions, they must see investments in the first level of care as an essential component of their COVID-19 responses. Countries must make care more accessible by reducing out-of-pocket costs, because no one should have to choose between their health and providing for their families. Today, we commemorate World Hepatitis Day, and we are reminded that too many people still cannot access the essential services they need to live long and healthy lives. So as we continue to be challenged by COVID-19, we must ensure our responses do not widen the gap in access to health, by ensuring that our health systems have the resources that they need to be resilient. By committing the necessary and overdue investments in our health systems, countries can safely respond to the pandemic and keep people healthy and protect them from a multitude of other diseases.
Muchas gracias, doctora Etienne. Vamos a pasar
Thank you,
ahora.
Dr. Etienne. Now we are going to go to our question and answer session. The first question that we have is from Rosmeris Bernal, journalist from the Prensa Latina Agency. She asks whether PAHO recommends vaccination against coronavirus in pregnant women and minors. She also wants to know whether there are minimum requirements for these vaccine proposals against COVID-19 to immunize these two vulnerable population groups. Dr. Barbosa, thank you very much for your questions. Yes, the safety criteria for vaccines are the same for all age groups. Vaccines need to go through phase 1, 2, and 3 trial clinical trials. The trial started with adults because adults are the ones with the highest risk for the disease. Some vaccines for COVID-19 have already undergone phase 3 studies for teenagers, and even some authorization was requested and received. So some vaccines have received the EUL. For pregnant women, we cannot run clinical trials in pregnant women. Uh, Vaccines are evaluation, and there is no live virus vaccine for COVID-19 and in general. So this means that vaccines are safe also for pregnant women. What happens many times is when you begin to vaccinate women in the general population, if some of these women were pregnant and they were not aware that they were pregnant, then these data are then assessed to confirm the safety in pregnant women. For the vaccination strategy, we have two different groups. Pregnant women who have some risk factors need to be part of the vaccination priorities because it has been confirmed that maternal mortality has grown due to complications of COVID-19. So we always need to do assessment of pregnant women who have other conditions. For example, if it's related to their work, pregnant women who are nurses or physicians working in hospitals who are in contact with COVID patients, or pregnant women who suffer from hypertension or diabetes or who are obese, then we need to assess them. And if they have a risk, then they need to be vaccinated. Adolescents are not a priority group. Adolescents should be considered after all the adults have been vaccinated. The first objective of the vaccine is to reduce deaths, to save lives, and teenagers need to go to a lower priority. Of course, the situation of vaccination in the different countries is different according to the countries. So when countries have vaccinated all their adults, they will start vaccinating adolescents. Adolescents with some comorbidity should already have been included in the vaccination schedules because if they have comorbidities, they could have serious complications after COVID. Thank you, Dr. Barbosa. Next question from Rosmeris Bernal. But also Blanca Valadez asked on the chat, ask the same question, could you provide some current data about the epidemiologic situation in minors and in pregnant women in the region? Dr. Aldeguerri. Thank you very much. It is a question related to the one just answered by Dr. Barbosa regarding the situation of pregnant women up until July 21st, 2021, which is the date of the latest regional report. 250,000 258,000 pregnant women with positive uh, tests, including 2,375 deaths. Uh, this has been reported by 32 countries and territories of the Americas, which have provided the information. This is 0.92% lethality rate. Regarding what, or in the context of what Dr. Barbosa answered, it is expected that vaccination for these population groups, together with the uh, social distancing measures and other health measurements, such as wearing masks and washing hands, will help decrease transmission. Regarding minors, the evidence available up until now indicates that children and adolescents are less prone to get the virus, but they play a role in transmission. And Dr. Barbosa talked about risk factors, and these are clear also in children and adolescents. And when we talk about children, when children acquire the infection, they are asymptomatic in general. And when they get sick, they have usually mild disease with symptoms that are similar to uh, the diseases that are normal in that age group. So using the database of the countries that are reporting the ages for cases, we can say that in the Americas, I repeat, 6% of the total of cases reported have occurred in minors. However, some minors may develop an inflammatory syndrome, which is multi-systemic and is more severe. And since the month of May of last year, 24 countries and territories of the Americas have reported 6,881 accumulated cases of this multisystemic inflammatory syndrome, including 135 deaths. So I hope that the information I have shared has responded to the questions of the journalists. Thank you, Doctor. The next question is by Nicolia Poor from Bloomberg in Venezuela. The question is, the president of Venezuela said that the first vaccines purchased through COVAX will be arriving in the country this month of July. Can PAHO confirm this? Is there an estimated date for arrival of vaccine and how many? And can you please tell us how many PCR tests for detecting COVID are being done in Venezuela? And have you used all the antigen tests that have come through PAHO to this country? Dr. Ugarte, thank you very much. Official communications between COVAX and Venezuela have confirmed that vaccines would be arriving between July and September, both Sinovac and Sinopharm. For this to happen, there are prior steps that need to be taken. I understand that these steps are being um, uh, accomplished quickly. So it is expected that Venezuela will receive a large amount of vaccines in the next few weeks. And as we had said before, there are available resources to complement the efforts for the vaccination campaign throughout the country. Regarding the PCR tests, the information we have is partial information, and therefore we don't have a specific piece of information in this regard, and there are still some antigen tests available in the country. And likewise, regarding the use of antigen testing, this is information which is not available to PAHO at this point in time. Thank you. Thank you, Doctor. Now, the next question is from Violeta Villar from La Web de la Salud, also about Venezuela. It says that the country has just reported 2 cases of the Delta variant. The question is, has the country reported these cases to PAHO? And regarding the Delta variant, the question is, what are the characteristics why this variant has a higher ability to be transmitted. Dr. Aldeguerri, thank you for your various questions. I will try to answer them in order. As opposed to the alpha, beta, gamma variants for which PCR tools are available to have a first orientation about it, confirming the Delta variable requires full sequencing of the virus genome. While we have some signs according to the screening protocols used in Venezuela, to this point, we have no evidence of circulation of the Delta variant in this country. However, it is important to mention that thanks to a very close collaboration and coordinated work with the National Hygiene Institute, Rafael Rangel, and the Venezuelan Institute of Scientific Research, Venezuela has been able to increase its ability to do genomic surveillance. And therefore, through this joint effort, it has been able to prove that there is co-circulation of different variants, including the um, alpha and gamma variants, which are variants of concern. And this one, the latter one, is one of the predominant ones in South America. Regarding the second part of your question, regarding the characteristics of the Delta variant of concern, there are different mechanisms through which the SARS-CoV-2 virus has adapted and evolved to affect human beings and become more transmissible. In particular, the changes and mutations in the so-called spike protein. So this spike protein has changes which may be associated with more efficient recognition of human cells. And in that manner, the virus is more able to infect and the transmission happen from one person to the other is increased. These markers, these molecular markers continue to be studied, and we continue to learn every day, every week, more and more about the characteristics of this virus. I hope I have answered your concerns about both Venezuela and the Delta variant. Thank you very much. Thank you, Dr. Altigeri. Now, I would like to give the floor to Kadim Joseph, health editor at Observer Media in Antigua and Barbuda. Kadim,
Thank you for having me. My question is, what is PAHO's view on having different standards and freedoms for unvaccinated persons versus vaccinated persons? And could these measures be seen as discrimination or undermine public health efforts?
Gracias, Kadim. Doctor Barbosa, ¿podría contestar?
Thank you, Kadim. Dr. Barbosa, over to you.
We believe that the most important thing is to provide the correct information to the people. Different countries, they have different laws about the voluntary or mandatory vaccines that they need to adapt and use in this situation. But it is very important to highlight that we are not facing a regular vaccination campaign. We are in the midst of the worst public health emergency in 1 century. We are in a situation that many groups have disseminated the false accusations against the vaccine, conspiracy theories about the vaccine. So it is really important to provide the correct information. We are working with the Ministry of Health, providing all the technical information. We are encouraging them to work with the journalists, with the media vehicles, but also work with people that can guarantee access to the social media, to invite the associations of nurses, of physicians, to share with their members also this information. It's a very challenging time. I don't believe that we can have a very simple solution to this very complex problem. So the best way is to provide clear and transparent information to the population, to the healthcare workers, in order to guarantee that they will have the vaccines that can save their lives, can protect their families, can support their countries to go back to the regular economic and social activities. So this is a very important challenge. And again, this is not a regular vaccination campaign. We need to prioritize communication, to be innovative, and to guarantee that the people is receiving the correct information about the vaccines in order to overcome the vaccine hesitancy. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you, doctor. The next question is from Kaylin Romero from El Confidencial Nicaragua. She asks whether PAHO has reported Nicaragua about the arrival of the vaccines and when would this be ready, and are there any variants of concern in the country, and how does PAHO consider the rate at which vaccination is taking place? Dr. Ugarte, I will answer some of the questions about the vaccine and the rate of vaccination, and maybe Dr. Aldeguerri could talk about the variants, since Nicaragua is one of the countries receiving donated vaccines. PAHO is also advocating with other countries so that those who have an available amount of vaccine, which won't be used in the short term in their own countries, could then turn around and donate it to other countries. Among them, some countries as Sweden, Spain, for example, have donated vaccines to Nicaragua. And for example, we have 134,400 doses of AstraZeneca that would be arriving in Nicaragua in the next few days. On the other hand, communications are between COVAX and the country. So PAHO is also copied on those communication, and COVAX has assigned over 200,000 doses of COVAX vaccine to the country. And the EUL has been granted to this vaccine, and also the cold chain has been ensured for distribution of these vaccines. They would receive Sinopharm vaccines, this in the next few weeks. In some cases, it is necessary to make additional adjustments to receive the vaccines, for storage of the vaccines, but also for their administration. And throughout this process, PAHO has been accompanying the immunization program of Nicaragua, both ensuring that the staff is appropriately trained, following the vaccination handbook, and generating information process, including new vaccines. And they have specialized teams, including 200 nurses and other technical staff supporting the logistics and the information system. And we have also received information that the most recent information that we have available is that about 250,000 people will have received or have already received one dose, and about 60,000 people have already received the second dose. These data will be updated, of course, in the next few days, a couple of weeks. Regarding the variants, I would like to yield over to Dr. Aldeguerri for his comments. Thank you, Dr. Ugarte. The regional network
Thank you,
of
Dr.
genomic
Ugarte.
surveillance is
Our genomic
available for
network
all countries in the
is a
region. It is a network coordinated by the Pan American Health Organization. And within this context, then, we have provided the health authorities in Nicaragua, the emergency center in Managua, and the health ministry with the tools, the molecular tools, the probes, to do a first screening of the first variants, which are high concern variants that have been reported in the region, alpha, beta, and gamma. And so they have those instruments available to the health authorities. The genomic surveillance network at regional level has 6 reference labs that can help all countries, no exceptions, as well as territories, to better characterize a situation, including sequencing, total sequencing of the SARS-CoV-2 genome, which is the reference instrument for confirming the Delta variant. These are the updates that I can offer you regarding the variants. Thank you very much.
Muy bien, muchas gracias a ambos. Me gustaría darle la palabra para hacer su pregunta en vivo a Wesley Gibbings de Caribbean Media Corporation. Wesley, si nos estás escuchando, tienes el piso. Adelante.
Thank you very much, Sebastian. Hemispherically and from country to country, rates of new infections and the rate at which people are dying vary considerably, even within the Caribbean region. What would you say are the major factors that contribute to the disparities in mortality figures in the region?
Gracias, Wesley. Doctora Alighieri, ¿podría contestar?
Thank you, Mr. Gibbons. Yes. And thank you for the
Merci,
question.
Mr. Biggins.
And a question with a Caribbean focus. However, some of my points would also apply to the rest of the continent. You have 2 aspects in your questions. First, the variations in the rate of new infections, and second, the variations in mortality. Regarding the rate of new infections, it is important to note that the main factor or factors influencing the dynamics is the strict application of public health and travel-related measures, or a suboptimal application of these same measures. Most of the Caribbean countries and territories are reporting community transmission. Some of them are reporting clusters of cases or sporadic cases. And as of today, only 2 territories are reporting no cases. Of course, I'm talking as of today. There were some evolution in the patterns in the Caribbean. Regarding the disparities in mortality, the major factors are, first, the access to health services, and second, the organization of health system for implementing strict protocols for suspected or confirmed patients that range from quarantine of contacts, isolation of cases, follow-up of the patient's clinical status at home, early detection of complications and access to health services, access to oxygen and medications according to the standards of care, access to ICUs, including healthcare workers, surge capacity during the peaks of transmission. So there are a number of factors around the organization of health system that have an influence on the mortality. In addition, in some countries with large territories, the geographic factor for accessing health services is playing a big role. It is where and when public health and primary healthcare level strengthening is key for the mortality reduction. I hope that I have answered your concerns, Mr. Gibbons.
Gracias, doctor.
Thank you, doctor. The next question has to do with vaccine access in the region. We received one from Vijani Raghovian from News from Guyana. And the question in English is,
to increasing access to vaccines to Latin America and the Caribbean. Dr. Etienne?
Thank you for this question. PAHO has been working with COVAX to ensure that at least 20% of the people in our region get vaccinated in 2021 to combat the acute phase of this pandemic. Of course, we know that we have not arrived at this target, but 20% is not enough. We want to go beyond that, as more vaccines are needed to vaccinate at least 70 to 80% of the peoples in our countries to control the transmission of COVID-19. So that is why PAHO, through its revolving fund, has recently launched a plan to improve access to additional COVID-19 vaccines for our countries in Latin America and the Caribbean, complementing the efforts being made through COVAX and the donations from other countries. So we have been working with countries that have available vaccine doses to get them to donate some of those vaccines to countries in our region where they are most needed. We know that this year, the availability of vaccines is limited, but PAHO is negotiating with the producers of vaccines, those vaccines that have already received EUL approval from WHO, to enable us to be able to secure additional doses. We are working in every way possible to secure more vaccines for the people of our region, where cases and deaths are still the highest in the world and vaccination rates are low. The PAHO Revolving Fund is committed to facilitate access to vaccines, as well as other needs such as syringes and cold chain equipment, to ensure that countries in our region continue to scale up their vaccination plans. Our proposal for direct purchase of COVID-19 vaccines through the Revolving Fund is intended as complementary to country agreements, the bilateral agreements, and also through the agreements with the COVAX facility. And our aim really is to help countries achieve the high immunization coverage that is required to control transmission of COVID-19. This initiative follows the same principles established by the PAHO Revolving Fund over the last 42 years of its existence. And those are high quality vaccines at affordable prices with equity, solidarity, and transparency. This pandemic will not be over until everyone has access to the vaccines that they need to protect them from COVID-19, and especially important to reduce complications and deaths from the disease.
Muchas gracias, doctora Etienne. Próxima pregunta.
Thank you very much, Dr. Etienne. The next question is by the representative of Deutsche Welle. How important is the release of the patents by Germany? Would we make greater progress in Latin America if Germany granted the patent to these vaccines, and how important has been the contribution of Chinese vaccines in Latin America? Thank you very much. Let me answer by starting with the second question. China has donated some vaccines to countries in Latin America and the Caribbean, and the US, very importantly, has also made bilateral donations or also through COVAX. Other countries such as Canada have also donated almost 18 million vaccines through COVAX. Spain is also donating vaccines. France is doing the same. I think that these countries are answering the call that the director has made several times, also asking those more developed countries to provide vaccines so that countries can make progress to protect the most vulnerable. We have also had good signs of solidarity among the countries in our region that oftentimes have shared their doses of vaccines. And this is very important to have equitable access to vaccines. And as to intellectual property, there are some decisions by countries from the International Health Assembly and also at the level of WHO and PAHO to use the flexibilities under the Agreement on Intellectual Property, TRIPS, and also the flexibilities that were agreed during the Doha round. So those countries may use them according to their laws and national regulations. So at this point, it is very important to have a more decentralized capacity to produce vaccines worldwide, so that intellectual property licenses are very important, but it is also important to have the ability to produce, because just to give away the license to produce does not imply that countries will have the ability, the capacity to produce the vaccine, and this may take years. And it is important to have the capability to produce the vaccine, and that's the reason why the Pan American Health Organization is leading a regional effort to increase production capability in our region by meeting with public and private producers, with the ministries of health. And in August, we are going to have a high-level regional meeting on this topic. We're also going to have, as part of our directing council in September, a document for the countries to decide on the strengthening of the productive capacity in the region. And we are also coordinating in the region a very important initiative that is a platform to share the production technology for the RNA vaccines that are the ones that are used currently for COVID-19. Some producers are using that technology, such as Pfizer and Moderna, but they could also be vaccines that are going to be used in the future for other viruses. So it is important. We have already had our first meeting to share the platform. We have already received proposals in the region, and now those proposals will be analyzed, and the director will be analyzing this initiative when all of the initiatives are analyzed with all of the countries. But the idea is to take advantage of what we already have in the region, and also to support the countries to make an effort to invest, to train, to build capacity, and also to have shared production among various countries in the region for the new technology, and so have greater access for all of the countries in our region. So this topic is very important to guarantee that Latin America and the Caribbean may have the opportunity to use their current capacity, not only for the current pandemic, but also for other challenges in public health. Thank you. Thank you, Doctor. The next question is by Melina Ochoa from TV, Mexico City. And in the chat, she's asking, in connection with the epidemiological lights used by the country, and even though they have red light, there won't be any shutdown or closing down of the activities. Do these lights still have a role? When are we expecting a peak as the part of the third wave or new surge of infections that Mexico is going through? Thank you very much. PAHO has been informed of some recent changes in connection with the traffic light methodology that the country is using. The traffic light combines several factors to indicate risk and provide some indications. We understand that there has been an adjustment of the weighing of some of these indicators, such as the level of hospital occupancy and also suspected cases. We also understand that the evolution of the methodology is intended to avoid broad fluctuations in terms of the recommendations to the states for the upcoming steps. For example, maximum capacity within the indoor spaces, the use of masks, physical distancing, and also public activities. So the adjustments to the methodology behind the use of the traffic light system would be intended to have more accuracy and also be more representative of the indicators to be able to move to other lights, orange and red. And this should allow a better adjustment of the economic activities that are non-essential at the federal level. As to the trends in Mexico, at the federal level, at the national level, for more than 3 weeks, the Secretariat of Health of Mexico has shared with PAHO their assessment as to the onset of a third wave of transmission over the last couple of weeks. An upward trend has been observed in the Yucatan state as well as Baja California del Sur, and also in the federal district as well as in other states. I think it is important to mention that the dynamics behind this new transmission peak could be different based on the various geographical areas of the country and also depending on the population movements and other factors. I hope I have addressed the question by Ms. Ochoa. Thank you. Thank you. The next question is by Alina Diestre from AFP in connection with Cuba, and in English it reads,
and deaths are spiking in Cuba. Could you comment on this spike? Why is this happening? Has the situation worsened in Cuba since last week? And if PAHO is worried about the situation on the island? Dr. Ugarte?
Thank you for these questions. The COVID-19 transmission continues to be very active in Cuba. As of yesterday, a record of 9,323 new cases have been reported, and approximately 1,600 of them in Havana. The national health authorities in Cuba say that this increase of new cases is due to the Delta variant, and the National Institute of Tropical Medicine, Pedro Curi, has also indicated that this variant is circulating in other parts of the country. The situation has led, of course, to an increase in the occupation of beds, but also in the expansion of beds and conditioning field hospitals in the most affected provinces. As we know, this is happening in a situation where Cuba is having important economic challenges. And in the health sector, in the last few months, there has been a significant reduction on the availability of essential medicines and supplies for COVID-19, but also for other diseases across the country. Cuba is at this moment in the record number of cases in the entire pandemic, and we expect that the number of cases will continue to be high through August, and we hope that the country will be able to reduce the transmission and reduce also the number of cases. But the challenges are ongoing both for COVID-19, but also for other challenges that the health sector is now being seen. And the vaccination is, as we know, it's increasing also in several parts of the country, and more municipalities are now having more people receiving both the vaccine candidate and the Abdala vaccine that was approved by Cuban regulatory authority. Thank you.
Muchas gracias, doctor. Siguiente pregunta.
Thank you, doctor. The next question is by Milton Guerrero on the use of masks. He's saying that some countries of Latin America have implemented strategies for mask use, and he's asking what is the proper mask and how should it be used as to whether one or two should be worn. Dr. Aldiguieri. Thank you. I think that the first important comment is that the use of masks is part of a set of measures to control COVID-19. Masks need to be worn as part of a comprehensive approach that includes the adoption of all of the measures mentioned in the plans to respond to the pandemic, physical distancing, avoiding closed spaces where there is a high number of individuals without ventilation. So they still need to implement good ventilation and covering of the mouth and nose when coughing or sneezing. The implementation of the measures continue to be the same, and that includes the use of masks in public spaces, even by vaccinated individuals. In countries, the regulatory authorities within the ministries of health are key to make sure that surgical and non-surgical masks comply with these measures. Masks are personal protective equipment that are classified as N95 surgical or non-surgical masks. So those masks need to comply with technical specifications and recommendations to be considered efficacious. Those masks need to be adjusted to the face to reduce the risk of infection. To date, no country in the region has a recommendation to wear two masks, and national recommendations follow WHO PAHO recommendations. In addition to that, the recommendations for the use of masks need to be part of the activities against COVID-19 at the national, subnational, and local levels. I hope I have addressed the question by the journalist. Thank you. Thank you very much, Doctor. The next question is by Tanya Smith-Calvright from Tribune in Bahamas.
The CDC seems to have new findings. Please confirm if the CDC is saying that vaccinated people are now the spreaders of COVID-19. Dr. Barbosa.
Thank you for this question. And no, this is not true. The current transmission that we have in the US is mostly due to unvaccinated people. There is no statement from the CDC saying that this new increase of cases is related to vaccinated people. We know from the beginning, because many studies have already showed this, that the vaccinated people may transmit the virus. The CDC yesterday they released a new guidance affirming again that people that are vaccinated are protected not only to get the disease but also to transmit it to other people. And this was shown, I think, that a couple of weeks ago, the Public Health in England also released a very comprehensive study showing that comparing people vaccinated with people unvaccinated, people vaccinated had more than 50% less secondary infections among their family and close contacts. So the vaccination has this double effect: protect you, and can prevent a severe disease, a hospitalization, or even a death, and also reduces the chance that you will transmit the disease to your relatives, to your family, to your community. So it's not true that the increase in the number of cases is due to vaccinated people. This does not make any sense because, again, CDC yesterday said for the, I don't know, 10th time that all the data are confirming that the vaccination is protecting people to get severe disease, to be hospitalized, and also protecting other people to get the disease from people that are vaccinated. So you should be vaccinated for these very good reasons, both protect yourself and protect your family and your community. Thank you.
Muchas gracias, doctor. Siguiente.
Thank you very much, doctor. The next question is by Jason Bovian from NPR News. I will try to give him the floor so that he can ask his question. Jason, can you hear us?
I wanted to just ask about Haiti. They finally have vaccines there. I'm just wondering, given some of the other problems there, including the assassination, insecurity, how concerned are you about their ability to actually get these vaccines into people's arms?
Gracias, Jason. Doctor Ugarte, ¿podría contestar?
Dr. Ugarte, could you answer? Thank you, Jason.
The question, yes, Haiti is having a lot of challenges lately, and the vaccines have arrived in Haiti thanks to the generosity of the US, and we are working with many partners, particularly with the Ministry of Health and several others on the ground. And all the vaccines that arrived in Haiti have been distributed to all 10 departments already. And the vaccination is ongoing in the West and North departments. As of yesterday, there were 3,000 persons vaccinated, and the vaccination site planning is being planned to 10 vaccination sites in the West department where Port-au-Prince is located, and 3 per department in the other 9 departments. Also, the Ministry of Health, who is conducting all this process with the support of PAHO and several other partners, have authorized also that some private clinics can also apply the vaccine in close collaboration with the Ministry of Health. So no other place is vaccinated. So we are, even though in the middle of this difficult situation that Haiti is facing, the Ministry of Health and all partners are being able to proceed with the vaccination. And I think this is also a good opportunity to highlight that health is one place where many actors come together when the protection of the well-being of the population is in the middle. Thank you.
Gracias, doctor. Y ya estamos llegando al final de la sesión de hoy.
Thank you, doctor. We are reaching the end of today's session. We have some questions regarding variants, the Delta variant, and the question in English is,
stop new peaks or prevent new peaks of transmission due to the variants. Doctora Etienne.
So let me thank you for this relevant question. Of course, as we have seen today and even before, there are many questions surrounding the whole issue of variants. So as of today, we have all 4 variants of concern circulating in the region. And those variants of concern are the Alpha, the Beta, Gamma, and Delta. Evidence has shown that variants of concern are more transmissible than the original virus. 2 of these variants, the Alpha and the Delta, seem to carry an increased risk of hospitalization. PAHO's genomic surveillance network has reported the presence of at least 1 variant of concern in 49 countries and territories of the region. So far, the Alpha variant has been detected in 47 countries, followed by the Gamma in 31 countries and territories, and the Beta in 20, and the Delta in 20. So obviously, countries are seeing circulation of 3 and 4 and 2 variants at the same time. We don't know if Delta will become the predominant variant in the region, as has happened in some countries. But let me say that this is a reminder to all of us that the pandemic is not over yet. The evidence that we are seeing is showing that Delta can be up to 60% more transmissible than the original virus. And so this means that we absolutely cannot relax public health measures. The more these transmissible variants circulate in our communities, the more cases will spike, health services will struggle, and people will die. Vaccines are our best hope to stop this pandemic and also to reduce the surge of new variants. So the good news is that vaccines work against all these variants, including Delta, in terms of preventing severe disease and deaths. The bad news is that we don't yet have enough vaccines to stop community transmission. But the other good news is that we know what to do to stop the variants. We need to maintain all public health measures, including the use of masks, social distancing, isolation of cases, quarantine of contacts, and vaccination, regardless of the circulating variant. The more the virus is transmitted, the more the chance we have to generate for the virus to generate mutations. And more variants are expected to emerge if we let the virus circulate without barriers and to infect more people. Driving transmission down is the only way to avoid the surge of new variants of concern that could put the gains that we have achieved thus far at risk. So let me again reiterate, we are all in this fight together, and there is a lot that each of us can do. You know, you and I know what to do to keep ourselves safe. So may I beg you please to do your part. This is not the time to lower our guard. And this is a time absolutely for solidarity. Please remember that none of us will be safe until everyone is safe. Thank you again for joining us today, and goodbye.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al
Thank you
final.
very much, Dr. Etienne. We have reached the end of today's session. Let me remind you that you can continue to reach us through email and also find more information on COVID-19 and the situation in our region on PAHO's website, www.paho.org. Thank you again, and let's take care of ourselves. Greetings.